Well, they look terrible, and I'm told they're hurt. They hurt. We're talking about varicose veins. They can be inherited or the signs of weakness in the circulatory system.
Here to talk about ways to treat them are Dr. Gilly and Dr. Kosari from Dermatology, Laser, and Vein Specialists. Good morning to you both. Thank you so much for being here today.
It's great to be back.
First off, what causes varicose veins?
That's a really good question. As a matter of fact, first off, it's a very common problem that we have with varicose veins. If you look at the whole spectrum, meaning from spider veins all the way to varicose veins, we have about 50 to 80% of the population is affected. That basically means 1 out of every 2 people you encounter has some level of venous problem. Specifically, what happens with varicose veins is long-standing high pressure that takes a toll on the integrity of the vein wall. It causes it to collapse, which eventually gives it that rope-like look that we are familiar with.
I think you can see that in the picture, exactly.
Well, we mentioned that they can be unsightly and they can also be painful.
Right? Yeah, they can be. And we'll look at some of the pictures, and these are people that have just walked into our office looking like this. And they might have had it for 10 years, they might have had it for 5 years. Oof. And these are people that sometimes even their primary cares don't always pick up on it. These 2 people here were just in the past 3 weeks. So it's a big problem. It's a big problem.
Are they genetic, though? I mean, you said that,
Yes. Yes, the number 1 factor is genetics. So the first question I ask people is, how about your mom and dad? Do they have similar problems? You know, we didn't always stare at our parents' legs when we were growing up.
I know, we never did that.
But the reality is that if they've had problems, too, most likely. Women much more than men.
Mm-hmm. What's the difference between medical and cosmetic vein treatments?
So what you saw in the pictures earlier were all medical because the disease has gotten so bad it's caused enough reflux so they're bulging and they're popping out. When you look at the picture now and just see spider veins isolated in different areas like in the thighs and legs, and there's no other bulging, just like what you see here. That is a classic cosmetic spider vein, and we can either treat that with injections or laser, either one.
Okay, what kind of problems does this cause, Doc?
Well, different things. I mean, you can have achy, pain, swelling. People don't always realize that they're having these problems. At the end of the day, it's really bad. And people that are on their feet or sitting all day long, at the end of the day, they feel it. And they really know it when we treat them and it goes away.
Okay, let's talk about the treatments. How do you treat varicose veins?
A couple ways. First, we have to identify who they are. So we do screenings. And in fact, if anybody... Today, we want to let people know if they want to call in and mention the show, we'll be happy to set up a free screening. But you have to have an index of suspicion, so you have to know something's going on. Mm-hmm. Then you do that, you find out where the leakage is, and then we can use different ways like lasers or some of the newer treatments to get rid of them.
Okay, how invasive are these treatments?
So they're relatively minimally invasive. If you look at some of the procedures that we do in the outpatient setting, we actually have the patients come in. They're awake during the procedure. It's quick. They leave soon after. We have them exercising and up and about right after. We don't want any bedtime or anything like that. We want them bedridden. In terms of some of the cosmetic treatments we do, it's a 20-minute procedure, some stockings that they would have to wear afterwards, but that's really it.
Can we go back to the hands for a minute, those pictures we were just showing? Because I know that people also come to you for treatment of their hands.
Yes, this is something you wouldn't think of. And actually, veins don't have to be in the legs. In fact, 2 of the more common areas we look at treating are on the back of the hands. Now, these are people that could be working out or people that have thinner skin or just, the hands are what people see when you're shaking their hand, when you're looking at their hands. So aside from the brown spots, this is probably the second most common thing we do. We just shrink them so that we don't have to eliminate them completely, but there's enough of a difference that you can see it from across the room.
Tell us how successful these treatments are.
Cosmetically, very successful. As long as we make sure that there's no underlying issues and we treat all those first, the cosmetic patients do very well. The hand treatments, 2 to 3 treatments, and you really can't tell. So patients do really well, very, very well.
You're staring at my hands.
Yeah,
Maybe I need to call.
Stared at mine.
To learn more, call Dermatology, Laser, and Vein Specialists. The number, 704-375-6766. Again, 704-375-6766. Or visit them online at carolinaskin.com. carolinaskin.com. They do all kinds of things at the office. So nice to have you here, Dr. Kosari.
Thank you.
Dr. Munavali, great to see you again.
Thank you.
You both. Thank you.
Check it out.